Welcome to my scientifically informed insider look at mental health topics. If you find this video to be interesting or helpful, please like it and subscribe to my channel. Hello, this is Dr. Grande. I have a few different questions I'm going to try to answer in this video around the issue of mental health clinicians and what types of mental disorders they might have, and are they more likely to have mental disorders than people sampled from the general population. So when I use the term mental health clinician, and sometimes when I use the term counselor, I'm really talking about someone who can deliver psychotherapy in general. Now, counseling is a specific profession. There are professional counselors. But here I'm going to use the term mental health clinician and counselor to mean someone who's a counselor, psychologist, social worker, or some other profession that, again, delivers psychotherapy. So the first question would be, what mental disorders are relatively uncommon in mental health clinicians, and what disorders are considered common? Would we expect to see more often with mental health clinicians? So if we're looking at the disorders that are uncommon with counselors, I would say personality disorders. I don't really see a lot of personality disorders in that population. Now, looking at the personality disorders and considering the ones that I do see, probably the most common in that uncommon group would be obsessive-compulsive personality disorder. So this is a disorder where people have a perfectionistic type of trait. They like order and rules. And the other one would be narcissistic personality disorder. So this is a disorder where people feel a sense of entitlement, they're arrogant, and they tend to manipulate people. Again, I don't see personality disorders in general commonly among this population of mental health clinicians, but those are two disorders that would be more prevalent than the others in this population. Other disorders I don't see would include disorders that involve anger or violence. For example, intermittent explosive disorder, conduct disorder, oppositional defiant disorder. These aren't really overrepresented with mental health clinicians. I would say they're relatively uncommon. And two other disorders that are relatively uncommon with mental health counselors would be bipolar disorder and schizophrenia. Now, I think there's a few reasons why all of these disorders I mentioned are uncommon with mental health clinicians. One would be that if a disorder has any type of criminal activity component that's been associated with it, like intermittent explosive disorder can lead to arrest, antisocial personality disorder can oftentimes lead to arrest, conduct disorder, those would be underrepresented because it's difficult to find employment as a counselor with a criminal record. In terms of bipolar disorder and schizophrenia and other disorders where reality testing may be a factor, it would also be difficult to find work as a counselor because counselors have to be in touch with reality. They have to have relatively good insight. And this also speaks to the personality disorders as well. Personality disorders tend to have low insight, and that's challenging when trying to work as a counselor with low insight. So how about the mental disorders that I tend to see more often with mental health clinicians that seem to be relatively common? I would say depression, major depressive disorder. I've seen that quite a few times. Generalized anxiety disorder, substance use disorder, we see that actually quite a bit, and post-traumatic stress disorder, including post-traumatic stress disorder that might have occurred when the person was a counselor. We call this vicarious trauma. So they're exposed to the details of aversive events repeatedly, and this exposure can actually end up causing post-traumatic stress disorder. Now, some clinicians, of course, would already have it when they became counselors, but some could develop it later on because they're a counselor. So again, here are some of the uncommon and common disorders that I've seen with mental health clinicians. So the next question here is, are counselors more likely to have a mental disorder than someone in the general population? Now, this is really one of the most frequently asked questions that I get around mental health clinicians and mental health. And really, the idea here is that a lot of people believe that mental health clinicians are more likely to have a mental disorder than somebody in the general population. And I would agree with that. I think the research shows that fairly clearly, although again, there's not a lot of research to go on here. But in my experience, I would say this is true. I would say a mental health clinician is probably more likely to have a mental disorder than someone sampled from the general population. A lot of this is because of the substance use disorders. And what happens here is that if somebody has a substance use disorder history, they may develop an interest in helping people that have similar disorders. And to me, this actually makes perfect sense. If somebody has a history of excessively using alcohol and they develop the disorder, and they've developed different strategies and they've come to believe certain things about how to put the disorder into remission or how to cope with the disorder. They might want to share that with other people, so they might pursue an education in counseling or a related field. So this interest turning into a career, again, is understandable. It makes sense that we would see a disproportionately high number of people with substance use disorders having an interest in this field. If you think about it, if somebody, when they were young, was exposed to like a house fire, so their home burnt down and they escaped, and the firefighters came and put that fire out, they may develop an interest in firefighting. They may want to help people to not have to deal with the same thing that they went through. So they want to go out and fight fires and help to save people's lives. If somebody was involved in a motor vehicle accident and they went to physical therapy, and the physical therapy really helped them, they may want to become a physical therapist. So again, this makes sense, and I think this is one of the major reasons we see more mental disorders in counseling than we would see in the general population. So the next question would be, well, okay, if substance use disorders explain a lot of this, if we were to exclude substance use disorders, if we were to say, look, let's factor those out, let's control for those and move those to the side, would mental health counselors still have a higher prevalence of mental disorders than an individual from the general population? And the answer here is still yes. We would still see a higher prevalence of mental disorders with counselors. Again, we don't see much research with this, but I think one of the reasons this is the case is because of trauma. A lot of people, just like we see with a substance use history, a lot of people with a trauma history want to help other people that have been traumatized, so they enter into the counseling field. Another element I see here is that some people become counselors to fix their own mental health problems. And this usually draws a fairly strong reaction from people. A lot of times people look at this trend and say, well, that's a negative trend. That must be something destructive and damaging. I don't know. This actually makes sense to me too. If somebody suffered with a mental disorder and they want to try to find out what's going on, they want to try to understand mental disorders and thoughts and feelings and behaviors, it makes sense that they may want to pursue a career in counseling. I agree it's not always an ideal motivation. For example, you wouldn't want somebody coming into the counseling field and they're really fixated on their own problems and finding the solution and not trying to help other people. If you think about this from the standpoint of like a physician, somebody in the medical field, and maybe they took an interest in becoming a physician because they had a rare medical disorder, you wouldn't want them entering into that field and only focusing on that disorder and ignoring people with other disorders. So the same thing, of course, can happen in counseling. Also, sometimes if somebody has an experience with a mental illness, they tend to frame everything from that perspective. So there's a lot of growth, of course, that would have to happen, but anybody who enters the counseling field has to experience that growth. So again, it's not always an ideal reason, an ideal motivation, but I can understand why it happens, and I can understand how somebody could still, of course, become competent, even if they entered into the field with that motivation. Another reason I think we see more mental disorders with mental health clinicians is exposure to really challenging stories. Right? And when you work as a mental health clinician, you hear a lot of stories about suicide, depression, drug use, broken relationships, intrusive thoughts, terrible memories, scary memories. So it can be stressful listening to those stories, and sometimes the line between empathy and sympathy can get blurred. So instead of just understanding and communicating somebody's feelings, a counselor can start to feel the same way. And that's really the difference between empathy and sympathy. So empathy would be understanding and communicating, and sympathy would be having the same feeling. So it's very easy to get caught up in sympathy, and this can have a cumulative effect. So if somebody's counseling individuals for years and hearing these stories, and again struggling with empathy and sympathy, this can result in the development of mental health symptoms. We also know in the life of a counselor, in the career of a counselor, there can be specifically stressful events. For example, if a counselor has a client who commits suicide. And it's not really clear how often this happens. Some estimates say that a counselor will experience a suicide at least once in their career, about 30% of the time. So about 30% of counselors will have at least one client who commits suicide. I think the number is probably a little bit higher than that, especially for counselors in certain settings. But I could certainly see how some settings would involve a lot of suicide risk at all. So it really depends on where somebody works for that one. But still, having a client commit suicide is a major stressor and can really lead to a lot of different mental health symptoms. Another occurrence that would be considered an acute stressor would be being threatened with harm. Now, there's estimates that this happens to about 50% of counselors at one point in their career. I would say this is probably a little low. I think the actual number is probably a bit higher than that. And we also see that counselors are sometimes assaulted. And this happens probably a little less than 50%, but again, it really depends on what you mean by assault. Having a client attack a counselor directly, I haven't seen that too many times, but a counselor being involved in a physical confrontation, like trying to break up two other people in a fight, that does happen, I think, more frequently. And that's still a threat of harm, and that can still result in mental health symptoms. So there are a number of reasons why somebody in the counseling profession would have a mental disorder and then come into the profession. There are a number of reasons why a mental health counselor might develop symptoms as a result of being in the profession. And the other factor here is that the treatment doesn't always happen the way we would hope for mental health counselors. They don't have the same access or comfort level because of the small size of the mental health community. So a lot of times when a counselor develops a mental illness, they travel outside the area, sometimes outside the state, and then you run into other problems, like will insurance cover that treatment, the logistical difficulties of the long drive. So what happens much of the time is they just leave the mental health disorder untreated. So it's not just the development of the mental disorder that's a problem here, it's the lack of treatment. It's the maintenance of the disorder. Now, I've also seen situations where a counselor will go out of state or far away from where they live, and they won't even provide their name. They'll just go into an agency, they'll pay cash, they'll give no identifying information. Now, when that happens, of course, we don't know for sure that that person would be a mental health counselor, but it's reasonable to think that some people who do that would be from the profession, especially in talking to them if there are clues there about their career. Sometimes with counselors and mental disorders, it's really a problem of the stigma. Counselors know all too well the stigma associated with mental illness, and they worry about that too if they have a mental illness. So sometimes it's just a matter of not wanting that stigma or not wanting to admit the mental disorder is really there. And the last element here in terms of maintenance of the disorders, I think, is that mental health clinicians oftentimes have a low trust for other clinicians when it comes to treating them, right? So if somebody is a counselor and they develop a disorder, they don't trust other clinicians to treat them. There are a few different reasons for this. Again, it's a small community, so they know the other people. So a lot of times what I hear is, well, I know that person and they have their own problems, so I'm not going to go to them as a counselor. Also, even though we don't really think of counseling as an extremely competitive industry like other industries, another counselor, when somebody's a practitioner, another counselor is technically a competitor. So there's that too. If somebody has a mental health disorder, they don't want to help out a competitor. It may seem a little strange to have that type of mentality, but I've actually seen that quite a few times. So this whole idea of mental health clinicians having mental disorders and also not getting them treated in the way that they probably should is really a serious issue. It can affect, of course, the counselors, but also the clients. It can jeopardize care. It can affect the competence of the counselors. So we know that self-care is really critical here. Self-care isn't really just something that counselors should think about. It's really a critical piece of being a counselor, and it should be built into somebody's practice. Counselors need to remain healthy in order to enjoy their lives and meet their goals, but also to effectively treat clients. So the stigma around mental health here really needs to be removed. It has so many damaging elements to clients, but also, as we see here, to clinicians as well. I hope you found this description of mental health counselors and mental disorders to be interesting. Thanks for watching.